Hi everyone, I would like to introduce to you Dr. Nutan Sood. She is a doctor with immense experience and particularly in dealing with the COVID pandemic. Literally thousands of patients she has been seeing since the pandemic began. I thought it would be a very good idea if Dr. Nutan Sood could tell you many things or answer some of the questions which are in our mind. What are the myths and what are the facts? What are the questions and what are their answers? So I would like to ask her to begin with, please listen carefully because this would be a very important interview for you to hear and to use in your life with this pandemic raging all around us.
The second wave definitely had a large number of people who contracted the virus, but most of them remained asymptomatic, and they became the asymptomatic carriers, and passed it on to anybody who was immunocompromised. By the word immunocompromised, I mean that even if you have something like a chest infection or you have diabetes, blood pressure, any of the comorbidities, you are immunocompromised and you could have contracted the virus. The person who was asymptomatic doesn't even know that he has passed the virus, and that's the necessity of wearing your double mask.
What is your advice about what an ordinary person, a lay person like me should do wearing a mask even after one has been vaccinated?
We call this double masking, and the reason for this is if we have a consistent and correct way of using the mask, it will be a very critical step towards further prevention and spread of the virus. Now we have to get into a proper fitting mask, so that's the reason why I say a double one, that you can wear a surgical mask below, clip it onto your nose. Your nose is the most important area, and you could wear any other mask on top, but be careful that it is multi-layered because it's going to prevent the droplets forming and escaping out from your talk to the person that you are interacting with. Masks are imperative when you are moving out of the house, when you are going into a crowded place, you're traveling. That is the time that you have to get yourself fully protected.
So is it important that we must have an N95 mask?
It's not important. It's not important. A surgical mask, and the ladies can definitely wear their designer masks, but it has to be a multi-layered one.
Much confusion about vaccination. Please clarify to us whether we should have one jab or two jabs, whether it should be 4 weeks or 8 weeks or 16 weeks.
Now, since the outbreak of the COVID-19, the whole world galvanized into finding a solution as to how do we interact with the virus. Well, vaccines take a very long time to really be made. It's an intense study which can run up to 5 years, 6 years, 8 years. But with the advancement of technology, we have been able to do the same within a year's time. I would want to make it very important to one and all that vaccine is not the cure for COVID-19.
Very important.
It is a prevention. It is protection against mortality. Every day we are getting fresh guidelines on the vaccines. Now, India was one of the premier countries where the vaccines were made, one by the Serum Institute at Pune and one by the Bharat Biotech. The initial guidelines were you take the first shot, which prepares your body to receive the virus if you contract it. And the second jab was at an interval of 4 weeks, and after that your body starts making the antibodies towards fighting the infection. But as studies progressed, fresh guidelines started coming in, and they found that even after the first shot, the antibodies remained in your system for more than 4 weeks. So they said 6 to 8 weeks. Further studies said you can go right up to 12 weeks. So it's a choice which you have to take. Either you take the Covishield, which is at an interval of 6 to 12 weeks, and the Covaxin, is up to about 4 to 6 weeks. Every citizen has to get fully vaccinated.
Okay.
That is very important. And as I said at the start, that we have to start practicing self-protection,
Okay.
which is a very critical step. That if you have your masks on and they are worn in the right way, you maintain your social distancing when you are outside, I'm sure you are going to get a lot of immunity and you'll be able to go out once again.
Great. And you're talking about good nutrition?
Yes, good
You're
nutrition.
also talking about say,
Keeping a positive frame of mind.
Yes.
And I would like to tell everybody, do not treat every illness that you get that it is COVID until proved otherwise.
I'm not very clear though about this concept of this infection of black fungus.
See,
What is this black fungus and how dangerous is it actually?
See, one of the line of treatment, of course, is the steroids, because we have to attend to the inflammation of the lungs that is taking place, the breathlessness that we see in patients. Now, most of the patients that we see who are contracting this are the ones who are having comorbidities in terms of diabetes. So, if you have diabetes, you are already immunocompromised. The steroids exacerbates it and the virus enjoys it. I would term it like this.
Well said.
Now, this black fungus is usually found in the soils, but it is airborne, and if you are immunocompromised, it can definitely attack you. Again, the route is through your nose. So, there have been few cases where doctors have been trying to do some extraction of the teeth or attend to some nasal problem, and they see this black growth in your nose. Now, from the nose it can travel to your eyes. The next route is to your brain, and it proves to be quite fatal.
If you had COVID, or even if you haven't had COVID, or you have been exposed to the infection, what is the long-term kind of, I wouldn't say treatment, but care that one needs to take, either if you are caring for a patient or you happen to be a patient yourself in the long term?
See, post-COVID complications are again becoming an issue with us.
Related to lungs?
No, related to any part of the body.
I see.
Well, I'm working in an ICU, and I've already started dealing with patients who have come in with post-COVID complications. Now, there could be, or there would be, fibrosis which will take place in the lungs of people who have been affected by the virus, which will come in about 3 weeks to 6 weeks time. They will start getting symptoms of mild breathlessness, or they might get some kind of tiredness. I've seen cases where it has affected the heart, it has affected the brain. Now, while I cannot correlate it and say it is a post-COVID problem, or it was a problem which was already there to come, but since we are living in the COVID era, everything we tend to connect with COVID. Until proved otherwise, I don't think we should really get very worried about it. It is only that take all your medications, whatever have been prescribed to you, at the right time, and I'm sure everybody will sail through it.
Great.
See, COVID affects basically the lungs. The route is from the nose, it travels down to your pharynx and to the lungs. So, basically we have to have a good lung exercises, where we do our pranayams very well, we do our breathing in and breathing out, our lung expansion. They are the rehab exercises post-COVID.
Excellent.
So, if we follow those little things, I am sure everybody will be in a better space. But what further effects later on, a year from now or 8 months from now, what we see is something which time will tell.
So you think building the immunity is also equally important?
Well, now, no, I would talk a little about the immunity boosters.
Excellent.
That everybody suddenly started taking zinc, everybody started taking vitamin C.
Right.
Well, this became a real boon for the industry, people who are making the zinc and the vitamin C.
Right.
Well, I would not really, emphasize too much on it, but yes, taking vitamin D3 is much more important. I would say that COVID is not a social stigma. COVID doesn't distinguish between caste, creed and man. A person who has already contracted the virus, I would say they are in isolation for 14 days. But once they come out of isolation, they live in a better world because they have experienced what COVID is, and they have definitely built up their own immunity, and those are the people who have to wait for some time to get their vaccines because they've already developed their antibodies, and then they take the vaccine at least 6 weeks after contracting the virus. Now the COVID antigen is a report which is an instant report. You get the report reading in about 20 minutes time, but that's not the answer to let you know whether you have COVID or not. It is only the answer for us to admit you or not to admit you into an ICU or into a ward, just to differentiate that. But the main report that we do is the RT-PCR swab test. Now RT-PCR swab test everybody is familiar with, that they put a stick through your nose and put around your throat, and those tests are then sent to the molecular lab where the testing is done. Now depending on the revolutions that your tube goes through, suppose the revolution is only 5 and the virus has been detected, your RT-PCR scoring will come as 5. After revolution of 14 times, if it came positive, the answer would be 14. If it came 25 times, your answer would be 25. Now the earlier the revolution, the earlier the detection. The later the revolution, that you do have COVID, but it could be moderate or it could be very mild. So on this report, we do advise patients, if it's around 20 or 15 or 18 and no comorbidities, and the individual have their own facilities of room with their bathrooms, then we ask them for home quarantine. And if they have any problems which are surfacing and which cannot manage at home, then we transfer them to the hospital. But 9 out of 10 times home quarantine is working.
I would like the benefit of her advice, which is experienced, knowledgeable advice. She is a very experienced doctor, to reach out to people in this age of what I would consider over information, too much confusion, and often a sense of panic, which is you rush here and you rush there. What is the logical sequence? What is the simple base level of activity we should have as laypersons to tackle COVID?
I do not want people to be scared. I am again emphasizing, I want people to be protected. Self-protection is protection for the community. Please do not be scared of this. We have been treating it from the last 18 months. We've taken our precautions. We've taken whatever we could do. And I think I've done the maximum cases of home quarantine. And I think I'm pretty successful in what I have been doing. So please understand, be patient, you will pass through this. This is a passing wave and everybody will sail through it. And sooner or later, as I said, we will live in a better world to come in.
And I would like to endorse that because I have experienced it.
Yes, thank you.
We are here, we are safe, I'm talking with you, and we have gone through the whole process under the guidance and care of Dr. Nutan Sood. This is the first installment of Dr. Nutan Sood's conversations with you about myths and facts about COVID.
Yeah.
Wait for the second installment, more on that. But take care and take full note of her recommendations, because they can be a guide in this confusion and plethora of information and disinformation about COVID.